and welcome to another episode of Navigating Cancer. I'm Dr. Joey Bennett, joined by Wendy Hall, who is our clinical social worker at the Robert Boisneau Oncology Institute. How are you?
I'm very good.
All in green. I'd almost think it was St. Patrick's Day if we knew that we weren't there. So,
yeah.
Welcome back to another show. First of all, I want to thank all of you who have given us some feedback on the show. We've had a lot of feedback from patients and people in the community watching the show. We've had some ideas sent in to us for future shows. We really do appreciate the feedback. We're glad to know that you're out there watching the program.
And not only that, join us on Facebook. If you like us on Facebook, then you'll see pictures of, and you'll have information as to the upcoming guests.
Very good, exactly. Tonight, or today, we're going to talk about breast cancer. Breast cancer is one of the big four cancers that we treat. And as we go through tonight's program, we're going to talk about breast cancer. We're going to talk about how it begins, what can be done for it, and things of that nature. First slide that I want to show you really is kind of the structure of the breast so that you get an idea of what we're dealing with. This picture shows you a magnified view of the breast, and in the circular area, you see little lobules which make breast milk, and then you see it tailing out to the ducts, which then transfer the milk to the nipple when women are breastfeeding. This is basically the structure of where these cancers start. The rest of the breast is mainly fatty tissue, and all breast cancers start in either the lobule or the duct, and therefore we call them lobular carcinomas or ductal carcinomas. And if they're confined to the duct and the lobules, then we call them in situ, versus when they invade into the fat, then they're invasive cancers. And breast cancer is a very big topic, as you'll see on the next slide. And hopefully you can read this. 1 out of every 8 women in this country will be diagnosed with breast cancer. And when you look at the next slide, you kind of get an idea of how this varies over the age of our country. We're going to have over 200,000 cases of breast cancer in this country this year, and a woman's risk of developing breast cancer over their lifetime is 1 in 8. It's about 13%. And so, me being the father of 2 girls, absolutely I want to do everything I can for us to try to lower the risk of cancer being and developing, but then once we have the cancer, you certainly want to try to treat the cancer. And I doubt that there's anyone watching the program tonight that does not have someone in their family that's been affected by breast cancer. I mean, we see it all the time, talking about parents and relatives and such. So when it's 1 out of 8 in your lifetime and 13% of women, you're certainly going to see a lot of breast cancer. You can see on the slide, though, it varies greatly with age. When you're young, between 30 and 39, your chances are very low, but as you get into your 50s and 60s, it starts going up even higher. And what's not on that slide are women who are in their 70s and 80s. And we see women every day, every month in this community. And in our next segment, we're going to have Dr. Mark Fernandez, who is a surgeon with Inverness Surgical Associates, talk about this. But, this is a retirement community. We see a lot of elderly patients in our community. We see a lot of people who are going to be living, to be 80 and 90.
Correct.
We can't sit here and just assume that because you're 80 or 90 that you don't still need to be screened and worry about breast cancer, because so many people...
And I think that's lacking,
I think that too many people pay attention to the statistics and they say, well, if you're over 70, quit looking. Well, if your mother and father both live to be 100, you don't want to quit looking, because if your parents live to be 100, you're probably going to see that age as well. And so screening should really be based more upon life expectancy than it should be based upon how old a person is. Go to the next slide and we'll show you some of the facts that are associated with breast cancer. You can see that it is the second leading cause of death and the second most common cancer in women in this country. And again, the incidence greatly increases with age. And one of the things that we want to try to highlight is that every woman is at risk of developing breast cancer. Yes, some women genetically are more prone to developing it because they may have a family history of it. But the majority of women, roughly 70 to maybe even 75% of women who develop breast cancer, are the start of their family history for breast cancer. So you can't just sit here and say, well,
nobody's had it in my family.
Yeah, no one's had it in my family. I don't need to be looking for it. It's like colon cancer. It's like prostate cancer. Just because no one in your family has ever had it doesn't mean that you don't need to be looking for it. Doesn't mean that you don't need to be screening yourself and watching for it. And we'll get into some of the warning signs on the next slide. sometimes the earliest detectable breast cancer will have no warning signs, and we will cover that later on, because by the time you get to the symptoms that are showing on the screen, you have gone typically beyond a non-invasive cancer, and now you're dealing with an entirely different situation of how it's going to be treated. But some warning signs that you can look for at home, other than getting your regular yearly mammogram like we'll talk about in a moment, is if you notice any change at all in your breast. If you notice a lump or some thickening of the skin, some swelling that persists, pain around the nipple, or maybe a change in the nipple. Sometimes women will get a retraction or a pulling in of the nipple. You can have irritation or dimpling of the skin. Sometimes the skin can actually look like an orange peel with the dimpling and the swelling that's there. And then any discharge from the nipple. I mean, these are not normal situations that you should be dealing with. And so any of these signs come up, immediately alert your primary care physician. Let them know that something is going on. And what they're going to do is they're going to turn around and they're going to send you for a mammogram and some additional studies. That mammogram is the one that allows us to find this thing faster than we're ever going to. Next slide. There are some risk factors that you can look at. Some of these we can control, some of them we can't, but women who have never had a child, women who are overweight, women who go through menopause, start their menstrual periods very early or go through menopause very late, women who have a pregnancy late in their life, at 30, 35 or so, women who have estrogen replacement therapy history, they went through menopause, they decided to take estrogen replacement therapy. All of these things increase the risk of breast cancer, because if you look at what's in common with them, it's women having periods for long periods of time and never having a break in them. By having a child, by becoming pregnant, you run into a situation where your body actually gets a little bit of break from the estrogen. So unfortunately, if you start your periods at 9, don't go through menopause until you're 60, and never have a child, you never interrupt that cycle of estrogen that is feeding the breast and sometimes causing a higher risk of breast cancer. The one thing that is not on that slide that we cannot control is your genetics. I mean, you can't change your mother, you can't change your father, that's already been set, and genetic history really cannot be changed. Next slide, we're going to talk about in the next segment what we can do as far as detecting breast cancer. Once you detect the breast cancer, how do you go about treating that breast cancer? And we're very happy to have Dr. Mark Fernandez, who is a surgeon. He and I came to the area about the same time back in 1993. He'll be with us in the next segment.